Do you guys think bleeding gums are normal? No, it's absolutely wrong. If you have bleeding gums, you should visit your dentist because it is caused due to the presence of plaque or calculus. So you should visit your dentist and get your teeth get cleaned.
Now I am going to explain you about the difference between plaque and calculus. This is called plaque. A very thin biofilm is formed, and this is formed just after eating any sticky substances. Bacteria gets combined with the proteins present in the saliva, and these and all nutrients, waste products, enzymes all are going to attach to it, and these on all combine together to form a very thick substance, and such that the membrane is formed around the bacterial colonies. You can remove this by using regular normal brushes. If you are not going to remove this, then it's going to turn into calculus, a very hard substance. Calcium deposits, hydroxyapatite, which are present in the mouth, all deposits will combine together and form calculus. It is called Lemanthermus tartar. So these causes gingivitis, inflammation of the gums, swollen gums. If you touch your teeth with your tongue, you are going to feel a fuzziness. So this is called plaque. And very hard substances, you can feel the very hard substance. This is called calculus. So these are healthy gums, and gingivitis causes reddish gums. And if you are not going to take care, then it's going to be a periodontitis, means exposing of the roots, and the inflammation prolongs for many years. It may turns into chronic periodontitis and severe type. Even some cases, mouth ulcers are also seen due to repeatedly touching, and bad breath is the most common thing what we will observe in this. What you have to do is you want to brush your teeth regularly and wash your mouth after every meal. If hard substance is not removed by the brush, you should visit your dentist and get it cleaned. Scaling is performed by the dentist to remove the plaque or tartar. If you love this topic, please like, share and subscribe.